So forefoot surgery is surgery effectively on the toes and the bit just before the toes on the metatarsals. The foot can be divided broadly into three parts: the hindfoot, which is somewhere around the ankle, the midfoot, and then the forefoot. So the forefoot includes the toes and the metatarsals themselves. So the principal aim of forefoot surgery is to relieve pain. And at the same time, it almost always involves correcting deformity. Frequently, the commonest forefoot conditions are things like bunions, arthritic great toes, hammer toes, Morton's neuroma. And so the primary aim of all forefoot surgery should be the relief of pain and the ability to wear footwear. And at the same time, that often involves correcting deformity, which some people find either cosmetically difficult, but also difficult with footwear. The most common forefoot condition is probably a bunion. Medically, we call it hallux valgus. To a patient, and to me actually, it's a bunion. And that effectively describes a great toe which deviates towards the second toe, towards the outside of the foot, and the metatarsal deviates towards the inside of the foot. So patients often complain of a large red lump on the inside of a great toe, and the great toe starts to wander over and also turn over. So the surgery for bunions falls into two categories. It falls into corrective osteotomy, which effectively means breaking and straightening the foot, or fusion surgery, which means straightening the foot, but then making the joint solid. Traditionally, there are over 50 ways to break and straighten the big toe to correct a bunion. These days, the most common way amongst foot surgeons is to do an operation called a scarf Aiken osteotomy, which is a technique for breaking and straightening the toe. It's originally designed from carpenters. So it's a joint you can see in old wooden buildings, in old wooden barns, and it's a way of spanning large spaces. We've adapted it for forefoot surgery, and it tends to be the most common way to correct a bunion. So the risks of forefoot surgery, the list is effectively as long as your arm. The main risks are those of infection, wound healing problems, neurovascular injury, which is to say injury in one of the small nerves, undercorrection, which is where you don't quite get enough correction, overcorrections, which is where you push it a bit too far. The bones not healing is called non-union. Occasionally, some patients can develop a condition called CRPS, which is a neurologic condition where it makes the great toe a little bit painful. Some patients have continued pain. Taking into account all the complications of forefoot surgery, I would suggest to patients that patients have a 90% chance to 95% chance of being happy with the result. They've got approximately a 5 to 8% chance of having a problem. The commonest problem is stiffness of the great toe. And generally that can be resolved.